Hello and welcome everyone to the Friday Media Update with Mendocino County Public Health. My name is Cameron Brown, and we're very happy today to have Mendocino County Health Officer, Dr. Andy Coren with us. And as always, we'll get the COVID updates from him. After his presentation, we'll take some questions from local news media. And as always, we'll also be monitoring Facebook and YouTube for public comments. So let's jump right in. I'll hand it over to Dr. Coren.
Thank you, Cameron. And hello, everybody. The fall Delta surge looks like it is resolving, but there are good reasons to still be cautious. Our average daily cases went down to 13 cases per 100,000 per day, which is 40% less than 2 weeks ago, and consistent with the state's downward trend and our surrounding counties. Can we put on the first slide? See how we are set with the other counties. Great. Can this be made a little bit larger? Oh, perfect. There we go. Okay, so you can see Mendocino is the red line, and it has come down nicely from our peak in August, September, and it is now just a little bit above the, I think that purple line is Sonoma County. I don't see it on here yet, but it's Sonoma County is the purple line. We're the red, and Lake and Humboldt County are directly above us. The totality of the Rural Association of Northern California Health Officers, the blue line, is a little bit higher than we are, and that has to do with some of the other counties. We have today, unfortunately, I'm also seeing an increased rate of 15 cases per 100,000 per day. And we'll have to follow this to see if that is significant. Test positivity is down to 4.4%, and that is 30% lower than last month. But to put it in perspective, California's test positivity rate is 1.9%. Can we have the next slide, please? So this slide, the orange line shows how rapidly our test positivity rate has fallen. It also shows in the solid blue how the testing rate, the numbers of tests we're doing in the county, has also decreased. And this is important because we use the test positivity as an indicator of community transmission. However, fewer tests means that the reliability of test positivity as an indicator of community transmission is also decreased. The testing is now more accessible around the county, and the statewide turnaround time for the PCR tests is less than 2 days in 95% of tests that are sent in. So I want to encourage everyone to get more testing done. More people should get tested. We have 142 of our residents in isolation at this time, and 50 are in quarantine, and this number has been decreasing. We are currently providing shelter for 3 people, and in the month of September, our county provided 575 nights of shelter to 75 residents who are unable to quarantine or isolate in their own homes. I'm sorry to report that another Mendocino County resident, an 81-year-old woman, has passed away from COVID since the last report. Next slide, please. I also wanted to look at this slide, which was put together from county data. And what I wanted to point out is toward the bottom, you can see the red bars that represent the number of cases in 5 to 11-year-olds. It's actually the proportion of cases. And we see since May, and especially since July, that red bar is increasing, and that is cause for concern. And it is especially concerning to me because if you've read lately, there is a new variant in United Kingdom they're calling Delta Plus or AY 4.2 that seems to be driven by an increase in the rate in children. California has not seen this variant yet, and my understanding from the WHO data that came from is that it's still not exceeding the numbers of the current Delta variant. Next slide, please. This should show hospitalizations. And they have this one. Here we go. The hospitalized patients, the chart on the right shows that that has decreased very nicely since August. But I want to point out that at the bottom of that, all the way on the right, the bottom of that line that shows our decrease in October is not yet as low as it was in May, which was before the summer surge, or in last October before the winter surge. So we're not out of the woods here. And this is also reflected by the numbers in our intensive care unit, which is the graph on the left. So as of October 21st, we had 11 patients in our hospital, including 3 from other counties that are full in their hospitals. Additionally, we have 4 Mendocino County residents who are out of county because they require more care than we can give. This is basically unchanged from 2 weeks ago. Our intensive care unit availability today is 25%. Our hospitals are less stressed now from COVID patients, but they are still very, very busy. Monoclonal antibody treatments for early COVID infections, or even for prevention in those people who are highly vulnerable, in our county continue to be about 12 per week, plus 3 to 4 per week are being done in Covelo as outpatients. These treatments in exposed or early positive people with high risk can decrease the visits to the emergency room and decrease the numbers of admissions. Let's move on to vaccinations. The big news today is that third shots and boosters for Moderna and Johnson & Johnson are making their way this week through final authorization. The CDC has already approved these, and I hope today that the Western States Safety Review Working Group and CDPH will pass these so we can administer them here in California after CDPH makes its final determination. The Moderna third shot and booster will be half dose from the usual Moderna primary series vaccines. And Johnson & Johnson will be recommended as a booster as early as 2 months after the initial dose was given. We will also be able to mix and match doses from different brands. For example, a Johnson & Johnson vaccine might have been the primary, and a person wants to come in and get a booster or another shot, they could get Pfizer or Moderna at this point. So any vaccine can be followed by another brand for a booster, though recommendations are still to stay within the same brand as the ones that were done for the primary series. The Pfizer vaccines for 5 to 11-year-olds are scheduled to be reviewed by FERPAC on October 26th, and then followed by the other agencies. This has been found in several international studies to be 90% effective in 5 to 11 years old. The vaccine will be a different formulation to account for the age and size of younger children compared to adults. So we're not going to be able to just reach into the old Pfizer vials and pull out smaller doses. Now, this is the slide that I wanted to go over for how we're doing in our county. As of yesterday, we have administered 113,046 doses. 71.6% of eligible people in our county are fully vaccinated, and that's compared to the California average of 73.5. So it's a little bit less. Note that these percentages are going to decrease in 2 weeks because eligible is going to change to include the 5 to 11-year-olds. But as you can see, the percent of total population that are fully vaccinated in Mendocino County are 62.4%. From an equity perspective, we continue to exceed the state of California among the lowest resource communities and in the Hispanic population. In quartile 1, we have 80.6% of our population fully vaccinated, though it's a little lower than California in quartile 2, which is 68.2%. 57.9% of Hispanic residents are fully vaccinated in Mendocino County, compared to 66.1% of non-Hispanic whites. The disparity continues, but the Hispanic community is increasingly taking more vaccines. Using the federal data, it appears the American Indian community has had only 50% fully vaccinated, which is even more disparity. And this is also reflected in the significantly higher case rates and mortality rates in both the Native Americans and in the Hispanic population. Among age groups, those between 12 and 17 years old are now 47.3% fully vaccinated. And between the years of 18 and 49, those people are 66.3% fully vaccinated. Both of those groups are less vaccinated than California. On the other hand, those who are 50 to 64 years old are 83.5% vaccinated now, and the 65 and over group is 78.5%. So these are better than the California average. Public Health is currently organizing our schools, clinics, and volunteers to administer the childhood vaccines in school events, beginning, we hope, the first week in November, if it is approved by then, and if possible, complete the second doses in these kind of clinics by the winter holiday. Vaccines will also be available from providers' offices, pharmacies, and our county public health vaccine clinics ongoing. These vaccines may be given with this year's influenza vaccine and with other childhood vaccines that may need some catching up. Reminder about influenza. The season is starting. Last year, the cases, hospitalizations, and deaths from influenza were very low. This may have been a naturally occurring light year, but we believe that masking and staying home to protect against COVID also helped. We still worry about that twindemic where we have both influenza and COVID causing an epidemic at the same time. So flu vaccines are here and available at the clinics, in the providers' offices, pharmacies, and through the Department of Public Health. So please get vaccinated and keep those masks on. Protect yourselves and your families. Schools have still had no outbreaks. This is reassuring us that our screening and testing, modified and shortened quarantine are effective. We're very appreciative of the huge amount of extra work our teachers and staff have had to do to keep our children, our communities, and our schools safe. Outbreaks in the county have been resolving. There's only one outbreak that is ongoing at a skilled nursing facility, and that is winding down. And the Round Valley outbreak is also much better controlled, with very few cases being reported. As far as new orders, next week our restaurant and bars posting order will go into effect. While some people are still opposed, I'm getting more favorable reports now, and some people who've come back from Los Angeles or the Bay Area where they have mandates to be vaccinated to go into these facilities. Some of these reports have actually said how comfortable they felt knowing that all people inside were vaccinated. We're not mandating that now, but as this posting order is implemented, I think that our community will appreciate the transparency and more will feel confident to go out and eat. In the coming weeks, many more people will be mandated to get vaccinated or tested, such as fire, first responders, and EMTs, as well as county workers in Mendocino County, but also the state and federal and public workers, as well as those who work for businesses with more than 100 employees, will be mandated due to more state and federal mandates. In summary, I'm quite optimistic that we're emerging from the latest surge, but I'm also cautious, and I hope others will be also. We have not achieved the low community transmission rates that preceded last year's Halloween, Thanksgiving, and Christmas New Year's surge. Influenza season is now upon us, and if that yearly pandemic merges with the COVID pandemic, we could see a very bad season. Counties in the Bay Area have, as you may know, set some targets for lifting mask orders, but they are way ahead of Mendocino in vaccinations and below us in case rates. So I think it's too early for me to safely make a prediction about our county. I will continue to look for positive indications before I set realistic goals. So please get vaccinated if you're still unvaccinated. Also, now is the time to get your third shots if you're immune compromised, or booster shots if it's been 2 months since your Johnson & Johnson vaccine, or 6 months since your last Pfizer or Moderna vaccine. Plan on vaccinating your 5 to 11-year-old children as soon as that is authorized, probably in 2 weeks. These vaccines are very safe and effective, and they're free. And they will let us enjoy the holidays ahead, including travel, parties, with less worry and less illness. In the meantime, if you have symptoms, stay home as always, get tested, follow isolation and quarantine instructions, wear your masks in indoor public spaces and outdoors in crowds. If you go out to eat, keep your mask on except when actually eating or drinking. And for safer eating out, look for the new green signs that indicate that a restaurant or bar has all their staff vaccinated, and only vaccinated patrons will be allowed inside. And look for the yellow sign that says the staff are vaccinated or tested. If you can't be outside, remember to increase ventilation. Keep your distances from non-household members and remember your hand hygiene. For the upcoming Halloween and Dia de los Muertos holidays, use masks, but don't use a decorative mask with a COVID mask. Decorate the COVID mask, that would be fine. Enjoy pumpkin carving and other crafts, cooking favorite holiday family foods, decorate, watch scary movies, enjoy virtual parties. Keep parties small, preferably with family. Outdoors, enjoy community decorations from a car, go to hay rides, corn mazes. If you are going out in traditional trick-or-treating activities, stay in small family groups and avoid crowding during those activities. If you're passing out treats, use pre-wrapped treats or thongs or hang it up, and use hand sanitizer often. So stay safe and stay well, and I'll stay around for any questions.
Thank you very much, Dr. Coren. So let's move right into the questions from local news media. And let's begin with Mendocino Voice.
Hi, thanks for doing this as always. I was wondering, Dr. Coren, if you could elaborate a little bit about the increase in those case numbers for 5 to 11-year-olds. I don't know if we're seeing also any increase in cases for, I guess it would be 0 to 4-year-olds, but and whether or not that's something that you expect maybe will continue, or guidelines that you have for parents around how to think about activities in terms of that, if it's not related to the Delta Plus surge, because we're not having that here. Is it just due to increased activity between families, or what should people know?
You know, we did that study and produced those numbers. They're very small numbers, but the increase is concerning, like I said, especially in view of what may be happening in the UK with the new Delta variant. The point and the reason I wanted to bring it up is that many people say, well, it really doesn't affect the children, and so why should they be vaccinated? And these are very good reasons locally and also internationally to get that group vaccinated. I think all of the non-pharmacologic interventions should be exercised and taught to our children, and that'll go on for a while. But I can't say at this point with certainty that there are any specific things that bring up those numbers. I do think that during gatherings, especially during the holidays that are coming up, there would be much more of a chance for transmission.
Okay, thanks. Should we rotate, or should I ask another question? What would you all prefer?
Let's go through the rotation. Thank you.
Okay.
So it looks like we have Mendocino Action News.
Hello, this is Danila Sands, Mendocino Action News. Thank you for having this meeting. My internet might be cutting in and out, so I might only put in a couple questions here. One is, there is a lot of talk about mandates of vaccines, specifically schools recently. You know, there was a walkout recently on Monday. And I would just like to know if there has been other diseases just as dangerous as COVID-19 in the past, and there were vaccines for those. So what is the difference today? Why mandate this immediately? Why mandate it in such a way, like immediately in the schools? The governor stated a couple months ago, you know, employments and such. What's different with this one?
Well, this is the largest pandemic and the most fatal pandemic that we've suffered for 100 years. So that's one issue. The other thing is we don't have a mandate at this point, certainly for the children, but I think what he was signaling is that this vaccine is very safe and that our population is not very safe. And as we do with other vaccines for children, we have mandated many vaccines before children go to school. And this would be one of the ones that he has said he would make that mandatory for the children. And there are also mandates for the teachers. But once this vaccine becomes fully authorized, not just with the current emergency use authorization, he's saying that it would be a necessity for children going to public schools to have to be vaccinated. So I think it's just recognizing that this is a very severe illness and pandemic, and we should treat it the same way we have for polio and measles and chickenpox and many of the others that are mandated.
My follow-up would be, with the mandate vaccines for certain employment, we're starting to see a decrease in employees, such as hospitals, fast food chains, even staff, substitutes, bus school drivers. What is the solution for that?
You know, that's a larger economic issue, I think. Certainly some people are leaving their employment because of the concern about mandates. I'm not sure that the low employment is directly related to those mandates, although I think there are people who are making that as a reason. I'm not so sure that that's the entire reason. There are a lot of huge disruptions in workplace since this pandemic has hit. It's brought out enormous disparities, and I think people are looking at their lives in a different way. As far as the mandates for the society to get vaccinated, I think that we'll have more consistent employment, people not getting sick, isolated, quarantined as much if they're vaccinated. And I think that's the motivation for moving to get everyone vaccinated. I think the walkout is an example of how powerful some of the social media campaigns have been. And I think that those are a vocal minority of the population who discount the existence of COVID or the severity of COVID, the huge amount of research that's gone into producing the vaccines. And that's existed in other pandemics as well. So it's not a new phenomenon that people protested. But I wouldn't make as important that as much as the fact that we have over 600,000 people who died in the last year. Recently, they were talking about 145,000 children who are now without parents. There are huge negative impacts on our society and our children from this epidemic, and we need to do what we can to control it. And we have very effective, very safe vaccines that can do that, and they're free.
All right, thank you, Dr. Coren. So we have a lot of questions coming in on Facebook, so I want to try and incorporate one of those into each rotation as well. So let me pull up one of them here. Yeah, someone's wondering if you can talk more about natural immunity and how that compares to the immunity from vaccines.
Yeah, thank you. That's a good question. There has been more research done on that, and there's more being published. It is clear that that natural immunity from having had the illness lasts for a good 3 months. There's some variability about that because of the levels of people's immunity and other illnesses. And also the severity of the disease can affect the amount of immunity from the infection. So the level of immunity after an infection is somewhat variable, and how long it lasts is even more variable. So it may last at different levels between 3 and 6 months is what they're talking about now, whereas the vaccines seem to be able to last 9 months. Now, we're going to learn more about that as the vaccines have been around longer, and we're still searching for, well, how often will we need to do boosters of the vaccines. But it seems like the immunity after an infection is not as reliable, not as profound, and does not last as long as the immunity from the vaccine. So the recommendations are, if you've had an infection, I'm not going to say that's a good thing, but you're probably spared a reinfection in the next 2 or 3 months. There are some reported reinfections within that time, but by and large, many less. And so there's some protection. And it is one reason also why we don't require testing of people who are within 90 days of their infection. But there is no question at this point, and the research is coming out clearly showing this, that the immunity that's produced by the vaccinations is more profound and more reliable and longer lasting.
Great, thank you, Dr. Coren. So let's go back to Mendocino Voice, and if you have related follow-up questions, feel free to add those into at the end.
Sure, thanks. I did actually have one thing I was hoping Dr. Coren could clarify from the previous round of questions, just as a sort of follow-up to that, was that from my understanding, the requirements around COVID vaccines in schools are not significantly different than the ones that we've had for measles or polio or a number of other kinds of vaccines for school enrollment. Is that accurate, or could you just clarify that a little bit for people?
Well, we have longstanding requirements for childhood vaccines, and that is before entry to the schools. We can't yet require vaccines before entry to the school for 2 reasons. There are none who have received any authorization younger than 5 years old. And the other reason is that when we have these vaccines authorized on an emergency use authorization, we're hesitant to make the vaccines mandated in most cases. And so there's usually a lag time before we start doing that. And what the governor was saying about requiring this as the COVID vaccine to be included with the other vaccines that are required would mean, and I think what he said at the time was when it had full authorization. So remember, now we're looking for emergency use authorization, but the school mandate would be for after full authorization. Does that answer your question?
I think I'm mostly just trying to clarify. So right now, the COVID requirements in schools are actually sort of far less restrictive than the ones that we have had in place for a long time around measles and polio. There's sort of a set of
Yes.
requirements around vaccines in schools that currently existed before this pandemic. And comparatively, the requirements right now in schools are actually less strict than, say, if you don't get the measles vaccine.
That's correct. So with the measles vaccine, which is a fully authorized vaccine, there are very, very few exemptions. And now the mandates, as we call them, are usually to get vaccinated or show proof of testing or a religious exemption, a medical exemption, or I'm sorry, religious exemption. And in the case of those exemptions, testing can be substituted. So it's not a full mandate as we have with the other vaccines.
Right. I just wanted to kind of clarify that, because I think there's been some discussion about the COVID vaccine as if this is sort of a new, more restrictive policy in schools, whereas actually it's kind of even right now it's a modified, less restrictive version than what we have for many other common diseases and vaccines.
That's correct. Yes.
Thanks for clarifying that part. I think there's some of the language around, sort of when people use the word mandate and other things like that, I think has gotten blurry over the last 18 months. So
right.
I think on that note, I guess I was wondering if you could, just based on what you know right now, talk a little bit more about the testing availability and the frequency of testing that you touched on earlier in the presentation in terms of our test positivity rates. So it seems like despite having increased asks for people to be sort of regularly tested, it's actually seems to be the case statistically that the number of people getting regularly tested in Mendocino is dropping right now. And I don't know if you have any further insight into the availability of rapid tests, or sort of how the rapid tests piece of this might be fitting in to sort of how we can understand testing in the county overall.
Well, that's a good point. So the testing was quite high a month ago, and we did very well, and we have testing availability around the county, as I said. There's no question that there are hiccups at some sites, and we're getting that worked out, so that really there's local testing in all the areas of the county. As far as the tests that we count that were shown on that graph, they're only the PCR tests, and so the availability of the rapid tests, for example, Binax now, may be cutting into the use of the PCR tests. They're much more rapid results. We back them up when there's a question about them, and sometimes as a matter of routine, when there's a positive, we back them up with a PCR test. But as the PCR tests for surveillance goes down, then those that are done for symptoms, or those that are done because people are coming to the emergency room, are a higher proportion, and they'll drive the test positivity up. And so what I was trying to explain is that the utility, the usefulness or reliability of using test positivity for transmission rate in the community is less useful when there are less tests. So the more tests there are, the more we get an idea of how much of this virus is floating around. And so that's our condition now. There's a huge amount more of the rapid tests that are being done within the schools, but it's mostly school-aged children, although the teaching staff and the other staff are also being tested. But yes, we are using a lot more rapid tests, and those don't come out on the data that I showed you in that graph.
So if you could clarify this part, and if you can't hear me, let me know. I'm also having some internet problems. But I think my understanding was, the initial discussion around having county employees be doing regular testing or be vaccinated, or some of those things that I think are still yet unresolved on the county level, and also with the schools. are primarily talking about using rapid tests purchased either by the district or the county or a specific entity, and those aren't being tallied in the test positivity rates for the PCR tests that we get regularly. So can you just maybe explain a little bit more how those pieces fit together? Like, does the county know about all the rapid tests happening out there, and are those getting reported? Or how do those data pieces work together so that we can really understand what's happening?
Okay, well, that's a great question. So the pieces of data, all these tests come through many different reporting platforms. And although the rapid tests are meant to be reported, there is a lot less reporting of the rapid tests, especially as people are doing home tests that they can buy in a pharmacy, but also the tests, the rapid tests that are negative may not be reported as frequently as the negative PCRs. The PCR tests are done in a CLIA authorized laboratory, and they must by law report the PCR tests. So the Binax Now or the rapid tests are supposed to be reported, and in order to get those tests, you're committing yourself to report them, but they go on a different platform. And the state is trying to merge those platforms, but there's a lot of questions about how they can do that and how they will, we don't just collect the data for its own sake, but then we want to use it in a certain way. So when they decide whether to make those data sets combined, they want to be able to say, well, how can we use this? What additional reliability does it give us, or what more uncertainty does it give us if we combine them? The other part of it is that when a positive Binax Now comes out and it's followed by a PCR, which one of those do you count? And that's one of the problems that the state statisticians are trying to figure out now. How much will that influence what are conclusions that come from it? So it's a complex, statistical and epidemiological question, how we report those tests. So the one pure test that we have reported now, and I say that with a little bit of uncertainty also because those systems have to be maintained correctly, but the most pure data set that we have is the PCR test, and adding the Binax to that would confuse the issue, and so we're waiting for that to happen. I would love to be able to have that happen, but we're not there yet.
Okay, so just to clarify, sorry, and then I'm happy to rotate again, even though of course I do have more questions, but I think we've also been tracking the data as an outlet over this time,
right.
And I think my interest is we sort of have our own data set, and my interest is in part around being able to explain the significance of those numbers really clearly to our readers, because I think that is not, that's kind of the challenge. And so being able to understand those numbers in context, if I understand correctly right now, we have the numbers from the PCR tests, and those are reported daily from the county, but that is kind of a discrete portion, and there are this kind of chunk of other tests that may be occurring through Binax Now that presumably there could feasibly in the abstract be a case where someone gets a home test at a CVS and gets a positive, and that number does not make its way to the official reporting, and it's definitely not going to show up in the numbers that the county puts out daily unless it's duplicated by a PCR test in some way.
Absolutely, that's exactly right.
Okay, thank you. I think that's helpful for me to understand the numbers in context as well.
Yeah.
Okay, thank you, Mendocino Voice. It looks like we did lose Danoa Sands with Mendocino Action News. Maybe the internet issues did get the best of her, but if she comes back, we'll give her some more questions. So there's a few more from Facebook. One person asking, what about people that are dying from the vaccines? So wondering about any complications or issues with the vaccines.
Well, this rollout of vaccines is probably the best monitored of any vaccine in history. So we have standing up the vaccine adverse event reporting system that everyone who gives a vaccine is mandated, they must report any known complications. And we have VSafe, which is another reporting system that people who get the vaccines can send in what their symptoms are, minor or major. And there are thousands and thousands of reports that go in. Until they are reviewed, we don't really know if they are cause and effect, but a thorough review is done for all of the VAERS, VA, that's the Vaccine Adverse Reporting System, of all the VAERS reports, and any grouping of symptoms or very unusual symptoms that come in through VSafe is also going to be reviewed. So the safety of these vaccines, despite what's happened on the media, which reports some serious side effects, and there are serious side effects, there's no question about that, but the proportion of people who have been vaccinated and had serious side effects is significantly smaller than any of the other vaccines we've had. So they're in the range of 1 in several hundred thousands to 1 million. And other vaccines are typically, there are some severe side effects that happen 1 in 100,000 or even 1 in 10,000. But we accept that when there's a huge excess of severe side effects from not being vaccinated compared to the side effects of being vaccinated, then that is the time that we say, well, this is safe. And that is the original, when they look at these vaccines, those are the considerations that are made. So while and I don't have direct access to the VAERS reports or this VSafe reports, there's a couple of other local systems around the country, but the many more vaccine reports come in, and then it's up to the authorities to look at that statistically and sort through, well, this may be a consequence of the vaccine, or there's no way that this is a consequence to the vaccine. So, the word is still, that's come out from the authorities, is that these are extremely safe vaccines, and that goes for all of them. And you've seen, two concerns that were raised, and one was the blood clotting that happened and was associated with some strokes in younger women with Johnson & Johnson. And although that seems to be a consistent risk, the risk is extremely small, and the advice was for women in that age group to consider whether she would want that vaccine or an alternative. And I can say that many people, including many women, have elected to continue to take the Johnson & Johnson. And the same is true for the Pfizer in adolescent boys, causing some pericarditis and myocarditis. Those are inflammations of the surrounding of the heart and inflammation of the heart muscle itself. So understand that these kind of side effects, both the clotting and the myocarditis, pericarditis, they occur at a baseline rate, whether you have a vaccine or an illness or not. They happen in our society. And the question from the research point of view is, are they associated? Is it a cause and effect? And how significant is it, both from the point of view of numbers and from the point of view of severity of the consequence? So the severity with the myocarditis, pericarditis is that nearly all of those people recover within a couple of weeks, and they use very simple over-the-counter medicines. There's not another outstanding excess of those illnesses. And with the blood clots, there is more, but there's a baseline. And it was felt at the time that withholding Johnson & Johnson from the general public would actually cause more harm from people getting more COVID, and the blood clots that happen with COVID far exceed the blood clots that happen with the vaccine. So it was felt that would not be worthwhile taking off the market, but to advise people who might be at risk to give it a second thought. I hope that answers the question.
Thank you, Dr. Coren. And we'll do one more from Facebook. And this is more of a state level question, so we'll have to get your insights about this, but other states are doing the exact opposite of California. And they are fine and living this normal life that is being hung over our heads. So why continue in this manner in California? And that's the question.
So, in our country, every state is able to make their own determination of what's good for their population. And the person who asked the question is absolutely right. There are other states who've chosen to go other ways. The scientists at the CDC have made recommendations, and the various bodies in different states have taken those recommendations and made them into mandates or rules for their populations. As we look at the data, though, those states that have not, for example, mandated indoor masking, those states who have not, and I'll use a common word, pushed vaccines or have made it illegal to mandate vaccines, have had far more COVID cases and far more COVID deaths. So California is actually leading the nation in terms of vaccination rate, but also leading the nation in terms of the lower numbers of cases and the lower numbers of deaths. Now, when you look at that in the media, what I've seen is they just say the numbers here and the numbers there. But you can't just go by numbers because California is such a huge state and has such a huge population. So when they do a scientific review of what is the effect of these orders and mandates and requirements for vaccines and so on, we see that there's a direct benefit.
Thank you, Dr. Coren. It looks like we'll have time for maybe one or two more questions from Mendocino Voice.
Hi, thanks. So the signage requirements are coming up soon in about 10 days or so. And I have not seen any of them up personally myself so far. And so I'm wondering if you could maybe just talk a little bit more about how you envision that program working. It seems like we should have enough vaccine availability for any employer who wants to make those requirements, be able to have their employees get vaccinated. I don't know if you have any thoughts about sort of our current countywide vaccination rates and whether or not you think it's likely we will have a bunch of green lit businesses. If the county is going to try and enforce that at all, if no signs go up anywhere, if you could just talk a little bit about what we might all be able to expect November 1st.
So the order is for transparency. It's a consumer protection type of order. And that is I've issued recommendations for how restaurant and bar owners ought to require vaccination or testing of their employees. And the other recommendation is that they should keep their facilities free of the COVID by having only patrons who are vaccinated allowed inside, with some exceptions. And if they have those two requirements met, then they would hang up a green sign. I think it's a circle. And that would allow people in the community to say, okay, this restaurant is as safe as we can make it at this point. I want to go in there, and I'll have my meal or drink my bar, or drink my drink, or meet my friends there and be as safe as I can be. There are other owners who will elect to make it a human resources policy that their employees have to be vaccinated, and they don't want to require patrons to be vaccinated to come in. They would hang up the yellow sign. And for those people who say, I'm not going to bother with requiring vaccines for my employees or my patrons, that would be the red sign. And the signs are large enough to be seen by on the street level. And so the idea is that the policies of the store owners of the restaurants and bars are transparent to their customers, and the customers can elect where they'll go and where they feel the safest. And I think that people will feel safer where they see a green dot, and hopefully more people will come out from their homes who are avoiding going to a bar or avoiding going to a restaurant because they feel uncomfortable and they feel like they're putting themselves at risk. And so when they see some green signs, they'll say, oh, you know what, that bar on the corner, I think I can go down there now. And they'll patronize those bars. So that's how I see it rolling out. We'll see what happens in the community.
Okay, thanks. Yeah, I'm interested to see as well. I just haven't seen any signs, so I'm not quite sure. It's hard to predict what it might look like November 1. I think I have one other question if there's time, which is sort of whether or not, I know this may in some ways be a decision that involves the county supervisors as well, but whether or not you had any kind of updates or insights into sort of those orders that are, I think, on hold potentially around county employees and certain kinds of staffing. The last discussion that I'm aware of it coming up was in terms of scarcity of rapid tests and to sort of delay implementing requirements for county employees or law enforcement or firefighters until there was some kind of resolution reached around both rapid tests and potentially around healthcare costs. So I know some of that might, be a different branch of county government, but I don't know if you can kind of give any insight into where those discussions might be.
Well, I think the Board of Supervisors slowed down the time, the deadline by which people had to be vaccinated or be tested. But we have a large number of our county employees who are now vaccinated, and in the Department of Public Health, I think there's like 4 or 5 employees who are exempt. And that's moving in the right direction. Let's just put it that way. I don't have the exact data in front of me about how it's gone for the county, but the tests are now more available, and they're more available for the county, and they're more available for police, fire, and EMTs as well. And they have their own sources of those BinaxNOW tests.
I think, but we have not there's been no new date picked in terms of the slowdown that's kind of functionally on pause right now, or has there been any kind of further discussion around when that discussion might come back, or those policies might actually be put in place with a little more teeth?
I don't have that information today. I'm sorry.
Okay, thanks.
All right. Well, it's
I know
approaching.
we're approaching time, so.
Yeah, it's approaching 3 o'clock, so I do want to give Dr. Coren a chance to give any closing comments.
Well, yeah, I think, all the questions that are coming up here, I very much appreciate as an opportunity to clarify and let people know what we're doing. It was very gratifying to see the numbers of cases come down so rapidly, but now the numbers give me pause. I'm not quite sure whether we're hitting a bottom, and if this is the bottom and we have a winter surge, it could be just as bad or worse than last winter. And so I'm sort of holding on to my seatbelts and watching those numbers pretty closely. But I will say that with the holidays coming up, make sure everybody is enjoying those holidays in the safest way possible for you and your family. And one of those ways is definitely to get in line for those vaccines. They are the safest and most effective and least expensive way to protect your families, yourselves, and all of our community against this pandemic. So with that, I'll close.
Thank you, Dr. Coren. Thanks for everyone who participated and listened today. We'll have the next update in 2 weeks. So that's November 5th on Friday at 2 p.m. And we hope you'll have a great, safe, fun Halloween and Dia de los Muertos. Thank you.
Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
ये bet me आया.
我们能够做到.
Podemos hacerlo por todos nosotros. ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
Namaste. આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
या ये है all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too. Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants,
which is what viruses tend to do when they spread.
Some variants are more contagious, while others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed.
when schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone, especially the most vulnerable among us. We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients.
For our elders. For ourselves.
For you. For us.
For our community.
Por nuestra comunidad.